So it just turns out, so remember I told you about that visit from the CEO of Kaiser. And one of the things he looked at was he looked at my body scanner and he was like, that body scanner is so cool. I've got, I don't know, 40,000 nurses just doing the same thing that your body scanner does. And I was sitting there and I was like, what just happened, right? We just built this body scanner, let's be real, some number of months. And I was like, again, obviously I'm thinking we're so badass, we're so cool, we're so awesome, but let's be real. Like, come on, like this, like something systemically broke here. Like we're not that badass. And so then I asked myself, well, hold on, how's the healthcare system work? And what you realize is, and this is going to blow your mind, he would make less money if he had our body scanner. Less money. And you're like, what are you talking about? No, Adrian, he would say he would make more money because he would save those 40,000 nurses. Obviously, nope, because he wouldn't have a billing code. He wouldn't have a billing code. What the fuck? So, before starting Forward, when I was at Alphabet and I was running my special projects thing, I went and I asked Tom Lee, really nice guy. He's the founder of One Medical. I asked him to grab lunch because honestly, I was pretty interested in just buying One Medical. I didn't want to start Forward. I was going to buy One Medical, give him $1 billion, and say, okay, go change healthcare. So I had lunch with him and I said, okay, Tom, imagine you had $1 billion, hypothetically. What would you do with it? And he said, oh, well, in healthcare, technology investment is not ROI positive. Now, let me be clear. Tom is a really nice guy, but this is the dumbest statement I've ever heard in my entire life, right? In healthcare, technology investment's not ROI positive. In gardening, it's ROI positive. Like, what the fuck are you talking about? But think about what he was saying. He was saying he doesn't get the money back because the billing codes don't change, right? He has no incentive to do the right thing for people. That's fucked up, man. That's bad. And so what did we say? Well, the first act of Forward, right? Get insurance companies out of the ball game. Literally get billing codes out of every part of what we do. So that was step one. Step two was to understand that employers are just as big a problem in this. So you ever notice, like, when you're at Square or whatever, like I'm sure Square was coming up to you being like, yeah, hey Daniel, once a year, like time to get your flu shot, time to get your flu shot, time to get your flu shot. I don't know, Dan, like, is there some big rash of flu deaths going on that I don't know about? Like, how many of your friends are dying of the flu? Like, how many? Come on. None. Not a single one, right? So, like, what the hell, right? But how many of your friends are dying of, I don't know, heart disease, cancer? Okay, they are. But did Square ever walk up to you and be like, Daniel, time to talk about your cholesterol. Come on, you got to get it down. Nope, not a single time. Not a single time. Why? Well, it just turns out that the average Square employee was with Square for, I don't know, probably 2 years, maybe 3. So here's the deal. You get the flu, you're out a couple days of work, maybe you take somebody with you, they're out some money. But let's be real, that cholesterol, that heart disease, that's gonna affect you in 30 years. They don't want to know about it, right? They're just literally they'd rather let's pretend we didn't hear about it, because that's gonna cost them money to start preventing it. Like, think of how fucked up that is. They're not trying to keep you healthy, they're trying to keep you healthy right now, right? And you know this. You actually intuitively know this because if one of your friends comes up to you and they're like, "Oh, I didn't get my checkup this year. I skipped it. I didn't go to the doctor for my checkup." You're not like, "Oh, geez, Bobby's gonna die." No, you're like, "Whatever, Bobby. It doesn't make a difference." Like, going to the doctor doesn't matter. In fact, you know it so viscerally that all your friends are like, "Oh, I'm gonna go read Goop or buy an organic smoothie to like prevent cancer." Like, what the fuck are you talking about? You think an organic smoothie is gonna prevent cancer? Method soap is gonna prevent cancer? That's how desperate we are. Literally, like, we don't go to our doctors to prevent cancer. This is how desperate we are. In fact, the only time you get a cancer doctor is after you get cancer. Well, do you put brakes on your car after the accident? Like, this is fucked up. Like, this is bad. We've created a healthcare system that's only focused on short-term health. Like, last 5 times you went to the doctor, how much you want to bet it was for flus, rashes, stomach aches? Well, okay, guys, but I'm going to die someday. Can we talk about that?